Welcome back to Fox 5's On the Hill. We want to continue these conversations we've been having about the impact of the government shutdown. We want to turn now to the anxiety and the stress it is having on federal workers, their families, and our community at large. One local therapist is offering free mental health care support directly to the public. For more on this, we want to welcome in Dr. Maliek Blade. He is an expert on this situation and someone who has been dealing really hands-on with these federal workers. You have been working on what you call shutdown therapy.
Right.
What is it? What is the idea behind it?
Yeah, so we partner with Immigrant Food, the restaurant on Pennsylvania Avenue. They have multiple locations, and we're offering 10-minute mental health check-ins for anyone that wants to drop by to talk about some of the stress they're experiencing right now.
We had a conversation just a moment ago about health insurance, the impacts of the expiring Obamacare health care tax credits. However, a lot of times people think about, physical health, injuries, disease, things like that. Mental health gets left out of this conversation a lot of times. What is your concern as a professional in this field about the healthcare crisis and mental health that we already have underway, and how that could grow even worse if more people were not to start getting the help they need?
Right. Yeah, this is why we immediately postured toward offering a free service, because it's our understanding that if people do begin to lose access to health insurance, they may not have access to mental health care. So there's this understanding that, unfortunately, we act as if our physical body is separate from our mind, but the mind is actually a part of the body. So those things go hand in hand.
You deal with folks a lot who I'm sure have to make financial decisions in their own lives. Federal workers are in that position right now if they're not getting paychecks. Oftentimes people look at their own health like repairing a car, but maybe the transmission needs to be fixed, but I'm not going to fix the wiper blades this month. Does mental health get put on the bottom of that list oftentimes when people are forced to make choices about care when it comes to financial questions?
Absolutely. Yeah, the assumption is more so focusing on the outside, how things appear. But in reality, the mind does affect a lot of the other areas of life. And also, there's this idea of metabolic health. What we eat has an impact on our mental health. So oftentimes we disjoint these things, but they're actually very much so interconnected. You
deal a lot with men. Men traditionally have been slow seekers of mental health services. What is it that you're trying to do right now to kind of break that cycle, especially with somebody who's maybe a federal worker who's responsible as the primary breadwinner of a family, to get them to talk about this and to at least kind of maybe lower the temperature a little bit on people's stress levels?
It's two things: normalizing the idea that it's okay to not be okay, and normalizing the idea that as a leader or provider that you can seek support and have weak moments rather than acting as if everything is going great.
This service right now, you're doing this in D.C. Does this have legs outside of the national capital region? Are there other federal employees that could make use of this?
Absolutely. The hope is for other therapists and organizations across the country to pick up this initiative to offer this support, because it's needed. And with the government being shut down, this isn't business as usual. People are suffering.
All right, we thank you so much. It's Dr. Maliek Blade. He is with the founder of the Whole Brother Mission, and they are doing these programs of shutdown therapy right now. It's critically important for a lot of people who are under stress. They just need to talk about this right now. They might not be able to solve it, but they might be able to kind of work on themselves right now.
Baby steps.
Baby steps. That's a great way of looking at it. We thank you so much.